Well, one other concern that is being voiced also by scientists is the failure of governments to look at data hard enough or actually lie and fudge about data. This is particularly being seen in the context of deaths being reported. The worry is that we are under-reporting deaths or underestimating the number of people who've been affected. Are deaths and cases being underestimated? What is the WHO position on that? Should governments be much more transparent about how much testing are they doing, how much antigen, how much RT-PCR, and more significantly, how many people are actually dying of COVID, Dr. Swaminathan?
There is no doubt, Rajdeep, that both cases and deaths are being undercounted. By what proportion? You know, there are many models and guesses that we can use. It's not really that important. But I think the really key element here is about our data systems, which is linked to our public health system. And I think this pandemic has clearly shown us what we've known for a long time, that our data systems need really to be strengthened. And I think there are many efforts going on actually on doing that, you know, using the digital tools that we have today. But it's not just enough to have that digital backbone or infrastructure. You need the trained people who understand what it is to report the right kind of data, because rubbish in is rubbish out. It's not a question of just entering anything. You need to collect the right data. And I think, again, looking ahead, this is a very grim reminder to India and other countries that investing in public health, investing in primary health care, as opposed to more tertiary hospitals, building that cadre of people, nurses, community health workers, pharmacists, physiotherapists, technicians, and of course doctors, who can work at that level and provide the primary care to prevent these huge crowds which now land up at tertiary care hospitals. I'm not saying that people don't need tertiary care. We do need, you know, the All India institutes that are being built. But if we don't simultaneously strengthen our primary healthcare system, no number of big hospitals is going to be able to, you know, because it's a question of not doing the early diagnosis and management, not just for this pandemic, but I'm talking in general. If you do not treat hypertension early enough, you are going to get renal failure that needs dialysis. You are going to get more strokes. You are going to get more heart attacks. So really our whole focus
is it in a sense, is it in a sense, therefore, that you think this pandemic has, in a way, exposed the frailties of what some are now calling a failed state, that we didn't invest enough in public health infrastructure all these years? We've been caught out on oxygen supplies. We've been caught out on ICU beds. Is it a man-made failure to that extent? The pandemic is there, but there's been a man-made failure in our failure to invest enough in public health or be prepared in a way for this second wave.
Yes, and these things don't happen overnight. You know, some states in India have invested. If you look at Kerala, I think it's been decades of investment in public health that, you know, then bore the fruit. And even that system is being overburdened. So you need a public health cadre. We don't have a public health cadre in most states in India. So it's a matter of investing over the long term. This doesn't happen overnight. And yes, we need to increase investment in health, with the large proportion of that going towards primary health and public health. And as you know, the WHO always, you know, its mantra is universal health coverage. And we are far away from that globally. Right. The number of people with out-of-pocket expenditures increasing.